It's a delight to be here with you all and appreciate the enthusiasm of the audience in terms of participation. I guess this is a popular topic, which is certainly understandable to me. Um, you should be able to see my screen now, so let us get rolling. Let me tell you what I'm going to tell you. Uh, the presentation objectives are at the end of the lecture. I hope you will appreciate the importance of sufficient sleep. And what I mean by sufficient should become clear during the lecture. Appreciate why we tend to get less sleep than we need. Understand the links between sleep, health, and illness. Learn how a good night's sleep will promote a healthy individual and healthy aging. And most importantly, learn how to improve your sleep or get a good night's sleep. So those are what I hope to gain, but I think we can do it in a fun manner rather than simply a dry presentation. So I'm going to start off with an infomercial. Do I have a deal for you? There's the product that can improve your concentration, sharpen your memory and your planning skills, help you maintain a healthy weight, improve your mood, improve your sex life, decrease body aches and pains, decrease your risk of accidents and of developing major depression, hypertension, cardiovascular and cerebrovascular illness, type 2 diabetes, cancer, and various dementias, such as Alzheimer's disease. Are you interested in this product? Of course you are. Now, the qualities of this product are quite amazing. What if I told you it was 100% natural? What if I told you it was free? What if I told you it had a lifetime guarantee? And most important, there are no shipping or handling charges. Are you interested? Absolutely, right? Well, this product is effectively sufficient sleep. I'm here to wake you up to the importance of sufficient sleep. And what sufficient sleep means is sleep of sufficient amount and quality to allow you to function normally during the day. And it's something we become more and more aware of. Sleep has always been considered kind of passive, secondary. You really don't think about it very much. But we've learned more and more that sleep is essential to health, and that disturbed sleep over time can have profound consequences for both your physical and mental health. And this has penetrated the public more and more. I mean, you know that sleep has arrived when Arianna Huffington writes two books about it, right? She knows where to go for a little money making. So sleep has arrived, I think. We now have learned quite a lot in the last 20, 25 years about the relationship between sleep and health. We've learned it's a complex relationship. It's not simply sleep as a passive process. Nevertheless, we tend as a society to get less sleep than we need. And there are reasons we're a sleep-deprived society. They're complex. But that sleep deprivation is very costly, both in terms of our daytime function and in terms of our health. And I want to address that briefly. Now, I'm a bit of a historian, so I want to start off with this very interesting quote from ultimately General of the Armies and President of the United States, Ulysses Grant, who said this before the Second Battle of the Wilderness, a key battle at the end of the Civil War. We shall have a busy day tomorrow, and I think we had better get all the sleep we can tonight. I'm a firm believer in the restorative qualities of sleep, and always like to get at least 7 hours, though I have often been compelled to put up with much less. And you can imagine that's certainly very true in Grant's case. And he looks like he's had a lot less than 7 hours in this photograph. Well, this quote illustrates a number of important things. It illustrates the recognition. It's been well known, and you could go back to Shakespeare, Hippocrates, Galen, the ancient physicians, that they've always recognized that sleep is related to health. The other thing that's important here is Grant quotes an interesting amount, 7 hours. Turns out that all the literature that we have suggests that for most adults, it's actually 7, not 8 hours that should be the target, quote, although people's ability to sleep exactly that amount vary. But the other thing, of course, that is important is Grant relates the importance of sleep to his busy day tomorrow. The recognition that it's not just sleeping well that's important, but sleeping well allows you to function well and to remain healthy. So, why do we tend as a society to get less sleep? One factor is the fact that sleep is easily sacrificed. Yeah. If your obligations socially or financially require you to, it's easy to cheat on your sleep. It's the easiest thing to give up. You can't give up the second job. You can't give up your activities. Heaven knows you just sleep less. And because it's easily done, we're willing to pay the price. Unfortunately, the price is significant. Um, Electricity, of course, has banned the night. There is no night anymore in the true sense. Here's the globe at night. And as you can see, just about most of the world is happily still awake with that electrical power. Society is now effectively 24/7, 52. And the recent glut of smartphones, screens, social media, all have their impact on screen time now, on people's willingness to sleep and ability to sleep. Many a teenager is, into the late at night, staring into their phones and tapping away messages between themselves. Uh, it, and that similarly can affect society at large. And it's not just the time that one spends on a screen, but we now know that those blue screens actually can interfere with your circadian rhythms and ultimately contribute to poor sleep. But our focus today is on aging, the aging process. And there are other causes of insufficient sleep that are common in aging. And this is a schematic I use to break down those causes. One thing that impacts older adults is something that I call age-related sleep change. There are changes that do occur in both the homeostatic sleep drive, that is the drive to fall asleep, and your circadian drive to keep you awake, that change over time uh, with in people that age, and that do impact their ability to sleep. There are clear changes that occur even in very healthy older adults where their sleep is different from younger healthy people. So we know that that's age related, but it's not by far the whole story. In fact, it's probably the smaller component of the changes we see in the adult population overall. A lot of the impact on sleep that we see in older adults is the result of comorbid medical and psychiatric illnesses. The impact of pain, the impact of depression, Alzheimer's disease, a variety of diseases all contribute to poor sleep. And indeed, sometimes the treatments for those diseases can similarly do that. Pharmacological agents, for example, that may help you in terms of sleep, in terms of the illness, may impact sleep adversely. There are also a number of primary sleep disorders that occur with greater frequency with age. These uh, are indicated here by obstructive sleep apnea, restless leg syndrome, REM behavior disorder, circadian rhythm disorder, insomnia. All of those primary sleep disorders actually occur with greater frequency in the older population. And then there's the psychosocial and behavioral aspects of an individual's lifestyle that can contribute to disturbed sleep. Uh, Irregular bedtimes, for example, poor sleep environments, learned behaviors. You can learn to sleep poorly, and that's something I'll come back to later. And then, of course, there's the catch-all, any combination with the above. And in fact, a given individual could have all of these ongoing, and it would contribute to their poor sleep. But it's not just the sleep that's the problem. It's the impact on daytime function and on health that we really need to concern ourselves with. If all it was poor sleep with no impact on abilities to function and health, well, it would be almost a moot change. But we do know that insufficient sleep has immediate daytime consequences. That after a poor night's sleep, you can have shifts in mood, you can become irritable, you have difficulties with a variety of cognitive tasks like concentrating, vigilance, memory, problem solving. You can also be sleepy and fall asleep inappropriately during the day as a result of poor sleep at night. And there's a concomitant increase of accidents and falls. Yeah. But that's the immediate daytime consequences. If you look at insufficient sleep over time, chronic insufficient sleep, you see that it increases risk for development of a variety of diseases. Obstructive sleep apnea has been linked to a number of illnesses and the increased likelihood of developing them or demonstrating that they're more severe. Short sleep duration is one of the most interesting discoveries in the last, say, 8 or 10 years, because short sleep duration has been definitively linked to development of metabolic syndrome and to development of type 2 diabetes. And insomnia, chronic insomnia has been linked similarly to a variety of disorders. And my own work has spoken to that. We did a meta analysis of the impact of various sleep disturbances on dementia risk, on developing dementias. And we looked at that longitudinally so that it's not just a simple association, but it's that reporting a sleep disorder at time one uh, can define the increased risk of developing a dementia over a defined period after that. These studies, many of them went out to 10, 15 years, 10-year follow-up in this case. And what we showed, I won't go through all of this, but just for the simple fact that insomnia, if a person reported chronic insomnia versus not, they had a 50% greater risk of developing Alzheimer's disease. And it's not just this paper. There are many, many papers that are confirming these relationships. And we used to think of sleep as a secondary process, that disturbances in sleep were the result of these illnesses. But we've now learned that having disturbed sleep may either predict or exacerbate the likelihood of people developing these disorders. So it's important to remember that sleep health relationships are bidirectional. It's a two-way street. And this makes research in this area a little difficult because sleep can be both the cause and the effect of a sleep health relationship. Poor sleep can contribute to the development of a disease, and similarly, the disease can contribute to the development of disturbed sleep. But either way, it can then be an epicycle, and they iterate, and one continues to make the other worse, and then the other contributes to the continued worsening of the disorder. The advantage here, though, is that sleep we can intervene in sleep quality. We can help people get better sleep. And therefore, that may, in some ways, moderate this relationship. And indeed, there's evidence to prove that. And I'll speak to that in a minute. So some people are fearful of bed, but I think we need to take a much more positive view of things. So let's turn to that now. Let's take the second step. Those are the reasons that we have insufficient sleep, but how do we deal with them? How do we improve sleep with age and therefore protect health or improve health? Well, let's speak to each of these. I'm going to speak to each of these factors. The first is age-related changes in sleep quality. Now, there have been countless epidemiological studies looking at large populations of various types that show that about 50% of older adults complain of significant and chronic sleep disturbance. And indeed, I've used that information as the rationale for a lot of the grants that I've had over the years, right? You have to show that there's a problem. But if you're talking about sleep age relationships, it's important to remember that there's another side to that coin. What about the other half of the aged population that doesn't complain about sleep problems? If it were simply age-related sleep change causing these problems, you would expect everyone to increase with their complaints as they age, but they don't. This suggests that disturbed sleep seen by older adults is not the result of growing older per se. Nevertheless, there are changes that occur. Well, one of the things that I do when I do these presentations, and especially when I'm speaking to older audiences, is I talk to the importance of recognizing that some aspects of sleep change occur with us all, and that a little education about that is potentially crucial. And I like to ask people the following question: how fast could you run a 100-meter foot race when you were 16 versus now? And everybody kind of realizes that physical prowess in foot speed changes with age, right? Our muscles don't work quite as well. We lose muscle mass. Our ability to respire changes, so that we're compromised in our ability to run quickly as we grow older. Yet, for some people, sleep takes on the properties that it's in the Bill of Rights or the Constitution: life, liberty, the pursuit of happiness, and 8 hours of uninterrupted sleep. But just as your physical body changes, your brain changes, and its ability to generate sleep is not quite the same as it was when people were younger. Uh, and so you need to hold that in mind, and recognize that one can be sleeping differently from a younger age. But the question is how one sleeps, and is it sufficient to function well during the day? The other factor was that relationship between sleep and comorbid illness. Now, again, acute and chronic illnesses increase in frequency with age, and they're going to contribute to disturbed sleep. And as I said before, sleep can be affected both directly by the illness, but also indirectly by consequences and treatments for the illness. Surgery, pain are examples. Bed rest. The simple idea of bed rest is very powerful in its ability to disturb sleep. I can take healthy young adults and just bed rest them, and over a period of a few days, their normal sleep patterns fragment and disintegrate. Just the very idea about not having the ability to do a normal rest activity cycle can result in disturbed and less sufficient sleep. And then there are also the issue of medications. A lot of times, one might receive a medication to treat an illness, but that could have an adverse impact on sleep. Let's take the simplest example of that. Taking a quote water pill if you have hypertension. If you take it at the wrong time of day, and it increases the likelihood of you getting up at night to urinate, uh, that may be problematic because you may have troubles falling back asleep. A lot of drugs may impact the autonomic nervous system or the central nervous system in such a way that they may similarly impact sleep. So illnesses, yes, but also treatments for them could sometimes contribute to disturbed sleep. Well, what's the wisdom about treating sleep disturbance when it's comorbid with illness? That's changed over the years. In the past, and indeed, if you go back far enough in my writings and my review articles, uh, the attitude we all took was that sleep was secondary, and that if in the face of comorbid illnesses, you had to treat the primary quote primary illness, and then the sleep would moderate if we could treat the primary illness successfully. But the new wisdom, which is based on a lot of clinical evidence, suggests that it's important not just to treat the illness, but also to treat the sleep disturbance. Uh, and in fact, if you treat the sleep disturbance, you can sometimes see benefit to the comorbid illness. And that's been demonstrated in osteoarthritis. That's been demonstrated in depression. It's been demonstrated in some anxiety disorders. We may see it demonstrated later in things like hypertension and cardiovascular illness. My own work has looked at the relationship of sleep in osteoarthritis and the relationship between pain and sleep. And what we've shown is if you simply take a population, an older population that has both osteoarthritis and insomnia, and you treat only the insomnia, you can actually improve the osteoarthritic symptoms, primarily because you may be impacting the pain relationships. What about sleep disorders resulting from a primary sleep disorder? That's pretty straightforward. We have effective treatments for all of these disorders. So if a person's sleep problems are the result of obstructive sleep apnea or restless legs, sleep clinics are set up to be able to diagnose these and treat them fairly effectively. Not optimally, but certainly to a degree where you significantly improve the quality of the individual's sleep, and that may indirectly improve their daytime function and perhaps their health in other ways. I'll talk about insomnia in particular here because insomnia is the most common primary sleep disorder in older adults. Now, some sleep changes are normal part of aging, right? That's that age-related sleep change. And education is effective in that treatment. That is, it's important for older adults to know what's an appropriate amount of sleep that they should get. And the answer is not necessarily 8 hours. The average that we've seen in healthy populations is 7, and anything between, say, 6 and 8 is just fine. If you get much below 6, that might be a warning sign. If you get more sleep than that, it may mean some other processes that are ongoing. There may be some medical burden that's contributing. If a primary sleep disorder is the cause of sleep disturbance, it can be treated directly, as I said. And the best way to do that is to get oneself to a sleep disorders clinic, like at the University of Washington, and seek appropriate treatment for those disorders. Uh, if the sleep disturbance is comorbid with an illness, as we've said before, you need to treat both. But there are a lot of situations where it's not the result of all of those things that I've talked about, but are effectively the result of a chronic insomnia. And this is the case where you have a chronic insomnia where you don't have the other medical burden necessarily, or you don't have these other primary sleep disorders, but yet the person is getting insufficient sleep at night. And what do you do there? Just to give you the definition of what chronic insomnia is, it's basically a complaint of difficulties either falling asleep, staying asleep, or waking up too early. And that has to cause distress or impairment. That is, it has to be associated with difficulties functioning during the day. And then there is some severity factors. The other thing that's important to recognize is that sleep difficulty occurs despite adequate opportunity to sleep. So if a person is willfully sleep restricting themselves, if they're only allowing themselves 5 hours of sleep a night and then they're complaining that they only sleep for 5 hours, well, that's not a chronic insomnia. That's a behavioral choice that they're making, and it needs to be dealt with differently. Well, what's the wisdom? We had a major breakthrough in terms of how chronic insomnia was treated about almost 10 years ago now, when the American College of Physicians came out with physician papers on the treatment of chronic insomnia. And they concluded that the drugs that were available for pharmacotherapy were okay for short term use, but were inappropriate for long term use. Mostly because we didn't know what the safety factors are out that far. And also, there are concerns with them not being as efficacious when used long term. There is some new, there have been some new drugs on the market since this position paper came out, but we still don't have enough data to really change this position that primary insomnia should not be treated with pharmacotherapy as the go-to gold standard. Rather, the gold standard treatment for chronic insomnia is something called cognitive behavioral therapy for insomnia. And, and that is what I'm going to talk about, both cognitive behavioral therapy and certain components of it, because these are approaches that can help most people improve their sleep if they feel there's room for improved sleep. If you're happy with your sleep, everything else I'm going to tell you is irrelevant. But if you feel you have a problem with your sleep and you want to improve it, some of these approaches may prove relevant for you. And they don't necessarily require going to a clinician and participating in a full-blown course of cognitive behavioral therapy, although certainly that's available, and I'll talk about that as well. So what is cognitive behavioral therapy for insomnia? It is a multimodal treatment. It is not one thing. It consists of a number of components, specifically sleep education, which I've already alluded to, development of good sleep habits, which I'll talk about, possible use of a sleep diary, and then two behavioral approaches, which I'm not going to talk about specifically today because it's not necessary to. But one is stimulus control therapy, which really helps people that have problems falling asleep, and the other called sleep restriction therapy, a terrible name. It's actually not sleep restriction, but time in bed restriction therapy that helps consolidate one's sleep and helps improve waking up during the night or waking up too early. CBTI can also include other techniques. One is a various relaxation techniques. I'll speak to that briefly. Mindfulness, and also cognitive restructuring, teaching people to think differently about their sleep, because sometimes people have misperceptions about their sleep and it can generate so much anxiety that those misperceptions and the resultant anxiety can keep people awake. So sleep education, that's accurate, fact-based information about sleep, like what's normal sleep for a given age, or what's the consequences of mild sleep loss. Are you going to die if you don't sleep sufficiently for too long? And it addresses erroneous assumptions and misperceptions about sleep, and also dysfunctional beliefs about sleep. And it's an approach that often helps people that are highly anxious about their sleep. Just for reference sake, I've given you some citations here where you can go and you can learn more about sleep education if this is something that you want to pursue. And I don't know if the slide set's going to be made available by the center, but if you want, you can follow up. I had my email address, which is vitiello@uw.edu, and I'd be willing to share this slide set with anybody that's interested. Good sleep habits. These are the behavioral and environmental factors typically under an individual's control that can maximize or compromise sleep. And this is where a lot of the bang can be gotten for the money. There are a lot of things that one can do behaviorally that can contribute to improving your sleep. Uh, by the way, if you want to take the approach of trying to do things to improve your sleep, and you pick out a few that you think would be viable targets, don't change everything at once. Do one thing at a time and see how it works. Be an empiricist. Do good controlled science and try one factor and see if that helps you or doesn't help you. And then move on to the other, and then move on to the other and see if they contribute or don't contribute. But if you try and change everything all at once and you improve your sleep, you don't know which of those is really helping you. And you may be wasting a lot of your effort changing things that really don't have impact. So the secret is to find out where the impact is and benefit by the improvement, but do it in the most efficient way possible. Just some hints about good sleep habits. Maintain habitual bed and rise times. Now, in older populations, this becomes easier because very often, if you're retired, you have more control over your schedule. Um, and in particular, if you were to do one thing, if someone said to me, I don't sleep well, and I think I've got some kind of insomnia going on. If I were to give them one bit of advice, a single bit of advice, it's get up at the same time each day. Regularize your rise time, and that can contribute tremendously towards regularizing your circadian rhythms and regularizing your sleep need and regularizing your satisfaction of that sleep need. And the reason it's get up the same time every day is that will help predict when you go to bed at night. The reverse is not necessarily true. If it's just maintain a regular bedtime, it won't be as effective. So maintain a regular rise time if you can. Keep your sleep aligned with your body clock. Go to bed when you're truly sleepy. What you don't want to do is go to bed and lie there awake for an hour or 2 hours and learn that the bedroom predicts anxiety. That's potentially a very problematic thing. You're hopefully going to fall asleep within 10 or 15 minutes once you decide to go to sleep and you've turned out the light. And basically, I told you stimulus control therapy is an approach that helps reinforce that. If you don't fall asleep within 15 or so minutes, it's good to get out of bed and do something relaxing until you feel tired and then return to bed. But remember, you also want to maintain that same rise time. Even if it takes an extra hour to fall asleep, don't say, well, I'll sleep in an extra hour, because that will continue to allow things to misalign. Uh, this is where I differ with some of my peers. Explore the usefulness of napping. Sometimes sleep people will tell you, don't nap. Well, I think you need to explore the usefulness of napping. Uh, Many people find a brief nap, 20 minutes, 30 minutes in the late afternoon, helps them with the second half of their day. Now, one potential problem with that is it may decrease your sleep need at night, and you won't have as much sleep drive, and therefore your nighttime sleep will either be shorter than normal or maybe a little lighter than normal. That's not a hard and fast rule. It varies for people. And so you have to explore whether or not a little bit of a nap, a short nap during the day, planned nap, is beneficial. So again, you need to explore the usefulness of nap. Make your bedroom a sleep-friendly environment. Right. Um, all of the factors that will contribute to your ability to sleep well, lighting, bedding, temperature, they're under your control, more or less. Um, and so you want to maximize them for yourself, or work out with your spouse or your bed partner uh, how best to approach it. Now we have sleep number beds where you can have different bedding and that type of thing. A sleep mask can be great if someone wants their bedroom environment darker than their partner. So you can play with these things. Develop relaxing bedtime rituals. You don't want to uh, have just read a mystery novel that's gotten you all excited and happy, or just watch television for a show that's been stimulating, and then you go directly and try and fall asleep. It's probably not the best approach. It's great to have some transition time when you're going from normal waking to sleeping, whether you're really conscientious about flossing and brushing your teeth, or you take a few minutes to just close your eyes and try and relax before you hit the bedroom. Develop relaxing bedtime rituals. Don't be a nighttime clock watcher. My wife once discovered this alarm clock that projected in large red numbers the time on the ceiling. So you didn't even have to look to the side to see what time it was. You could look directly above and know exactly what time it was, so that when you wake up in the middle of the night, you can be informed, right? Well, if you have an insomnia or you're an anxious person like that, that's deadly, because for two reasons. One, it doesn't matter what time it is in the middle of the night if you wake up, because if you have an alarm clock, it'll wake you up in the morning when you need to wake up. So don't, too much information is sometimes a dangerous thing, especially because we're terrible at judging whether or not we're awake or asleep. And it's quite possible that your eyes pop open, you look at this time up there, and it says 2:15. And you, of course, are annoyed that you woke up at 2:15, but you might fall back asleep and then wake up again and look up, and it's 2:45. And you're convinced that you've been awake that entire time, but you may not be. But that's going to generate anxiety. And when you generate worry and anxiety, uh, you generate and increase the likelihood of your sympathetic nervous system discharging a bit. And that's part of the fight or flight syndrome that stimulates your body, and that will increase the likelihood of remaining awake. So do yourself a favor, turn the clock to the wall. If you have to get up at a certain time, the alarm will get you up, but you need not be a clock watcher. Similarly, if you're a person that has busy brain, you wake up in the middle of the night and you worry about everything that happened to you the day before and anticipate everything that may be problematic the coming day, that's not going to help you sleep. So there are techniques where you can literally have a pen and pencil by your bed, and you write down the thing you were going to worry about in the middle of the night, and you can schedule time to worry about it during the day when it's less likely to interfere with your sleep. These are all things that will increase the likelihood of you being less anxious in the context of the sleep environment. Exercise regularly and moderately. and also make light work for you. Let's avoid bright nighttime light and get a lot of bright daytime light. And that's under your control to a great degree. You can get some of those little side lights that glow a modest red to guide you to the bathroom if you want, so you don't have to throw on all the lights when you wake up to go to your bathroom if you have to in the middle of the night. And because light is stimulating, and we're not meant to have bright light in the middle of our sleep period. It may impact our ability to fall back asleep. This is pretty straightforward. No pepperoni pizzas just before bedtime. And you can also see if there are light snacks that you can use just before bedtime. And I list these because all of these have high tryptophan levels. And tryptophan is an amino acid that is particularly conducive towards improved sleep. So you can have a warm milk and a banana, turkey, cheese, and peanut butter sandwich. And maybe that'll help you fall asleep. Avoid social drugs proximate to sleep time. And be aware that over-the-counter medications and prescription medications can adversely affect sleep. All these factors are under your control. If you've got prescription medications, always check with your physician about timing of them. When should I take them? And would it be better to take them at certain times than others where it'll be less impactful on my sleep? Sleep diaries are a way to chart the success, a person's sleep pattern and how much they're awake and asleep. And in classic CBT, they're used to chart progress. If you're doing this on your own, changing some of the behaviors that I mentioned to you, you might not need a sleep diary. But if you're interested in what sleep diaries are, there are some examples here, again, that you could pursue, but they're not directly relevant to what we're talking about today. One thing I want to teach you today, though, that I think is very useful is a relaxation technique that I've found is quite helpful, and most people that I've introduced it to have similarly found it so. Very often, relaxation techniques are complex or involve visual imagery, like, imagine something that's relaxing to you, a mountain meadow or a beach or whatever. Well, unfortunately, many of us don't have good visual imagery. We think more in words than in images. And so I've always been skeptical about prescribing visual relaxation techniques to people. Similarly, there are these elaborate techniques about loosening your muscles, muscle group and muscle group. And that's just so complex, and it requires learning how to do it and all of that. The advantage to what is called the Benson relaxation response, which is actually something that Herbert Benson, a famous cardiologist, stole from Eastern yogas, just learning deep breathing. But it involves breathing, and we all breathe. So we can all relate to breathing, even though we may not all have visual imagery. And it's a very simple, straightforward technique to use. It's useful to calm yourself down during the day if you have a daytime situation where you're feeling stressed, or to refresh yourself in the afternoon. But it's particularly useful if you either have difficulties falling asleep, or if you wake up during the night, which is not in and of itself a problem, but if you wake up during the night and have difficulties going back to sleep from that awakening. And you can practice the Benson relaxation response just lying in bed. As your eyes pop open, you've been awake for 10 minutes, you say, oh, this is terrible. Well, maybe let me try some deep breathing. And so it's quite simple. You're lying in bed, or you can be doing it sitting up, and you just get comfortable and you keep your eyes closed. And then you relax your muscles. I don't make a big deal of this step. You don't have to go through every muscle group and say, oh, I must relax my muscles and all that. Because some people, that kind of performance can actually go against things. You end up, rather than successfully relaxing your muscles, you make yourself anxious about, well, am I relaxing my muscles well? And then what you do is you slowly and deeply breathe in and out through your nose. And you can have a word or a sound if you're feeling a particularly yogic, you could say Om, or you could say one, or you could say relax, or you could, whatever it might be. And you can have that sound trigger with the exhale. And the important point is you attend only to your breathing. You try and eliminate everything else, anything from the environment that might intrude on your focusing on your breathing, anything from your head that might intrude focusing on your breathing, like all those worries you might be carrying or your anxiety about not sleeping well. And and you simply repeat this for a period of time, might be as little as 4 or 5 minutes, or until you fall asleep, either way. And if you're distracted, don't get
And
upset. Simply go back to attending to your breathing. Right? Don't let the distraction interfere with the process. And don't worry, maintain a passive attitude and permit relaxation to occur at its own pace. Now, the great thing about this is number one, it blocks thoughts. So if you're a person with busy brain and you've got worries, paying attention to your breathing will stop you, potentially stop you if you're doing it right, from concentrating on your thoughts and getting anxious about the things that your thoughts engender. But the other thing that deep breathing does is it actually triggers your autonomic nervous system and increases parasympathetic outflow. What I mean by parasympathetic outflow is your autonomic nervous system is the part of your nervous system that does things automatically for your body that you don't really think about. Your breathing, your urination, your digestion, those types of things. And it has two components. It has the sympathetic component and the parasympathetic component. And most of us are familiar with the sympathetic component because that's the fight or flight syndrome. That's the, if you're scared and suddenly your blood pressure picks up and your heart rate goes up and you're ready to fight or to run away. Well, the parasympathetic is like the balance to that. And it engenders slower heart rate, lower blood pressure, a more relaxed state. And so by deep breathing, you actually also trigger parasympathetic outflow. So you're not only stopping cognitive problems that might interfere, but you're engendering a deeper sense of relaxation in your body physiologically and will predispose you to falling asleep. So if I leave you with only one gem today, this is a good one. And again, as I said, you can do this during the day. If you're in a stressful situation or you're anticipating a stressful situation, it's a way to calm yourself. I used to play this game when I was on stair climbers in my gym, and my heart rate goes up very, very high. If I concentrate on my breathing as I'm still climbing the stairs, I was able to drop my heart rate by 10 or so points, even in the face of the continued physiological load. So this is a powerful technique. So again, this is cognitive behavioral therapy. The things we know from the extensive literature on this, because there's been a lot of research over the last 20 years, is it improves both short and long-term insomnia, chronic insomnia. It's efficacious for both uncomplicated insomnia, that is chronic insomnia that occurs all by itself, or chronic insomnia that's associated with a comorbid illness. In the old days, when it was being developed, people said, oh, that's fine for just pure insomnia. But if there's a disease on board, it's going to complicate things and it's not going to work. That proved to be completely wrong. It's been demonstrated to be efficacious in the face of almost any comorbid illness. And that can be both, and that includes major depression and the anxiety disorders. If you have, more cognitive psychiatric disorders that have more of a cognitive component of impairment, it's a little more complicated than that. CBTI-based improvements in sleep are also associated with improvements in comorbid illnesses, as I've told you about. So I've demonstrated that with pain. People have demonstrated that with depression. There's been similar demonstrations where you can improve anxiety when you're simply treating the sleep in the face of these comorbid disorders. There's sleep and CBT internet resources. There's a lot of stuff available, including some CBT programs where you can join online. Usually there's a fee involved in those, but you can basically get cognitive behavioral therapy via the internet for a very modest cost. But I'm not going to applaud any of them. This is a lot of general information, more information about CBT than you could ever need. There are also some books that are available. And of course, if you want to locate a CBTI practitioner, I would start with regional and local health centers. Again, you could contact the UW Sleep Center, but there's also the American Academy of Sleep Medicine and Washington Psychological Association, Society for Behavioral Sleep Medicine. They all list practitioners in different geographic areas. So lots of ways to get CBTI, and it's getting better and better to access CBTI. It was a problem for quite a few years, and it's still not as easy as it should be, but there are more practitioners being developed all the time. So I hope for a minute there it suddenly made sense. So let me review the take-home messages, and then we'll do questions and answers. Sufficient sleep, and what I mean by sufficient sleep is sleep of sufficient duration and quality, is a pillar of good health. Sleep disturbances in aging result from multiple causes, but one should never assume that an older adult's complaint is simply the result of getting old. It is typically not. Quite the opposite. Sleep education can be helpful under certain circumstances. If somebody has a sleep disturbance and a comorbid illness, you should treat both, not treat the sleep disturbance as secondary. If they have a primary sleep disorder, that requires direct intervention, of course. In almost all cases of sleep disturbance, CBTI, at least a review of sleep habits, is useful. And CBTI may also be useful. And also, as I said, if one effectively treats a sleep disturbance in the face of a comorbid illness, one can often see an improvement in the comorbid illness. The other thing that it's important to recognize is there are effective treatments for most of the disturbances in sleep experienced in older adults, which leads me to my final conclusion. Growing old does not mean sleeping poorly. Quite the opposite. You can sleep well, no matter what age you are. You may not sleep the way you did when you were 18, but you can certainly sleep well. So with that, I will wish you all peaceful dreams. Thank you very much.